Good morning, handsome. How you feeling?
I'm trying to load.
Okay, thanks for letting me know. I'll give you another minute before I hit start.
Okay.
So then are you still trying to get in, or is everyone in that wants to get in?
I'm still trying, but go ahead. I'll just
Okay, you can jump in whenever you want. I'll put the game pin down. You know, I'll write it down, but it should still be on there. And if you get in, you can ask me for the game pin and I'll tell it to you.
Okay.
All righty. So a 2-month-old comes in with suspected intussusception. What is the first line of treatment? An endotracheal pull-through, air or barium enema, surgical repair, or put patient MPO and place an NG tube?
First.
So yeah, you guys were kind of stuck, you know, between the patient MPO and place an NG tube or air barium enema. Does anyone want to share with the class like their definition, how you would describe what intussusception is? Are you just
I'm not 100%
guessing?
sure what it is, but I just know you want to do the least invasive first.
Oh, that's a great strategy. And you're right. So the intussusception, like you think about your colon is in segments. It's like different segments of colon. So intussusception is when one segment pushes into the other segment. So they call it a telescoping. So you can imagine like there's a tube here and then the tube that's just to it pushes in, and it causes an obstruction because it's like the segments get stuck against each other. So they can sometimes release that telescoping with an air or barium enema. And if not, then they might need surgery. So kids that come in with intussusception, it's usually around 3 to 4. They come in like you'll see it something described as red currant jelly stools. It's kind of like something I always think it's good to think about what's different about different diseases. So intussusception is really the only one where they call it this red currant jelly stool. It kind of looks like strawberry jam or something like that. And it has like these intermittent waves of abdominal pain. So sometimes it's better on its own. Sometimes they can do an air or barium enema, and sometimes they need to actually do surgery to pull the segments of the bowel apart. So what are the most common parasites in children which characteristically cause perianal itching? Roundworms, hookworms, pinworms, or ringworms? All right, so pinworms, this is the one we talked about. You want to keep their nails short. This is really contagious. They have to ingest the eggs into their GI tract in order to have it, but it causes a lot of itching. So the two things I can say that it's associated with is it's very contagious, it's very itchy. It's the Scotch tape test to test for it, where you literally put Scotch tape around their anus, and when you pull the Scotch tape off, you can see the little worms. And that you really have to treat the whole family because they are very contagious. They don't normally make you sick, though. It's just kind of more of a nuisance. Which symptom would you not expect to see in a patient with biliary atresia? Projectile vomiting, tea-colored urine, abdominal distension, or jaundice?
That's wrong.
All right, so you guys are pretty good, I would say. So projectile vomiting, you're always going to associate that with pyloric stenosis. So whenever you see, this should be the one where you see this, you should think, oh, that's probably pyloric stenosis. So biliary atresia is a problem where you're not able to drain bile from your liver. So these things are all true. You see this with biliary atresia, but this projectile vomiting specifically is for pyloric stenosis. Which of the following is considered a medical emergency? Phimosis, hiatal hernia, cryptocritiasm, or paraphimosis? So this one I think is probably one of the harder questions in here. This is where you're not able to retract the foreskin over the head of the penis, and it is an emergency if you really can't move it. So after inspection, which assessment is performed first when assessing the abdomen? Percussion, secondary inspection, palpation, or auscultation? Very good. Yeah. So you want to do anything that might be painful last. So you're going to take a look, take a listen, and then start feeling around. Precocious puberty, secondary sexual characteristics seen too early. Treatment includes estrogen, androgen, gonadotropin releasing hormone, or testosterone. All right, so good. This is another one that I think is pretty tricky. So the way I would think about this one is that, like, if you didn't know the answer, estrogen, androgen, which is a general term for sex hormones, and testosterone, these are all kind of similar. So even if you didn't know, so this hormone kind of regulates the other hormones. So you would want to choose the one that's different than the other three. So this one releases gonadotropin releasing hormone, regulates the other hormones. So you probably wouldn't be giving these hormones to someone that had precocious puberty, if that makes sense. And also just kind of as a test taking strategy, if you kind of don't know, you can look at these three and say, well, these are all pretty similar, so I'm going to choose the one that's different. Treatment of pertussis often includes which antibiotic? Penicillin, Bactrim, azithromycin, or Cipro? So I could see why you would be drawn towards penicillin. We talk about penicillin a lot with strep throat. So penicillin is the antibiotic choice for strep throat, but particularly for pertussis, it would be more common to prescribe Zithromax or azithromycin. What precautions are needed for an RSV positive patient? Standard, droplet, protective, or contact? Very good. So droplet. So just think anything that is spread by droplets, any sort of respiratory, you're going to do droplet precautions. Which of the following is an early sign of congestive heart failure? Weight gain, increased respiratory rate, wheezing, or cyanosis? So this one I think is another one that's kind of tricky. So you're going to get the fluid in the lungs. Over time, you are going to get weight gain, but you'll see the fluid in the lungs and the increased respiratory rate first. Which is not one of the primary symptoms of epiglottitis: dysphagia, drooling, dysphonia, or dysphagia. Yeah, so this one was one that I think is just kind of more testing your knowledge of the words. So dysphagia is like not remembering your words, whereas dysphagia is you can't swallow. So I wouldn't worry too much about this, but I think you guys all know that epiglottitis is that swelling right around the vocal cords where they really can't breathe. So this was kind of more of a tricky question, kind of testing your knowledge of vocabulary words. But the main thing with epiglottitis is remember that it is a medical emergency and it's that swelling right around the vocal cords. Which of the following is a late sign of respiratory distress? Restlessness, retraction, cyanosis, or tachypnea? All right, good job, you guys. So, you know, you don't really look blue until you've been having a hard time breathing for a little while. So good job with picking up on that. Very good. So which of the following is not correct about describing asthma? Symptoms are due to inflammation and bronchoconstriction. Most commonly occurs in Caucasians. An exacerbation may present with low-grade fever, or stress, pollen, and cigarette smoke can be triggers. Right, so it's not specifically in Caucasians. You'll see this, you know, in all ethnic groups. Good job. So hemophilia home care teaching should include teaching about how to identify internal bleeding, signs and symptoms of infection, importance of hydration, or infection control principles. Very good. So hemophilia, they're missing a clotting factor, so they're more likely to bleed. So you need to teach them about how to identify internal bleeding. What is the #1 way to prevent a child from getting epiglottitis? Hand hygiene, albuterol inhaler, the Hib vaccine, or oral care? All right, so this one is a little bit tricky. So epiglottitis is bacterial infection. It's most obviously caused by Haemophilus B influenza, which is a bacteria, even though it says influenza on the end. So the way to prevent it is through the vaccine. If they don't get a Hib infection, then they're not going to get epiglottitis. What are the classic signs of esophageal atresia and tracheoesophageal fistula? Olive-shaped mass in the right upper quadrant, visible peristalsis and vomiting, bilious emesis and frequent stools, current jelly stools, failure to thrive and abdominal pain, or cyanosis, choking and coughing. All right, very good. So this olive-shaped mass in right upper quadrant, visible peristalsis and vomiting, this is going to be your pyloric stenosis. Bilious emesis and frequent stools. Bilious emesis, there's something going on, kind of small intestine. Current jelly stools, failure to thrive and abdominal pain. This is your interception. So the cyanosis, choking and coughing is the right answer. Esophageal atresia, the esophagus doesn't go down to the stomach, and transesophageal fistula, there's a connection between the trachea and the esophagus. So they're, when they eat, either, the esophagus doesn't drain into the stomach, or there's a hole between the esophagus and the trachea and it falls into their lungs. So you'll see this, it's not always diagnosed before they're born. You see this on their first feed, that they cough and sputter and turn blue when they try to eat. Which of the following is not a symptom of cystic fibrosis? Rectal prolapse, productive cough, meconium ileus, or frequent infections? All right, good job. So remembering that CF is both lung and GI, but it's not associated with rectal prolapse. So what is the priority intervention in a neonate with exstrophy of the bladder? Position the baby in the prone position, cover the exposed bladder with plastic wrap, catheterize to empty the bladder, or prepare for intubation prior to surgery. All right, pretty good. So this is the one where they're missing the abdominal wall. So their bladder is exposed. So you're not going to put them prone because you're not going to put anything on their exposed bladder. And the bladder just it leaks because it's not being protected. So you're gonna, it sounds kind of gross, but you're gonna cover the bladder with plastic wrap. They are gonna go to surgery, but the first thing you're gonna do is you're gonna kind of prevent infection by covering up that exposed area. The most common reason for an ED visit for a child with sickle cell disease is acute pain crisis, infection, stroke, or priapism. Very good. Acute pain crisis. So if a child has a stent post hypospadias repair, which of the following are contraindicated? Restricting fluid intake, suctioning, giving an enema, or giving a bath in the tub? So this is kind of tricky. So hypospadias, that's that urethra is not, in the middle of the penis. So you don't want to give them a bath in the tub till it's totally healed because you don't want any water, dirty bath water getting up into their surgical site. What is a characteristic symptom of croup? Wheezing, retractions, seal-like cough, or crackles? Very good. So it's also called a barky cough. This is the one where you want to give them some humidification if you ever have talked to somebody. Sometimes they can also have stridor. So seal-like barky cough and stridor are sort of the classic symptoms of croup. What type of toys are appropriate for preschool children aged 3 to 6? Bike with training wheels, wooden blocks, cooperative board games, or all of the above? Yeah, good job. You know, not really necessarily a 3-year-old, but you're getting into the little 4 or 5. They like to play Candyland and stuff like that. So all of the above. Good job. What vaccine is given prophylactically to high-risk infants every 2 months for the first 2 years? Pneumococcal, Synagis, influenza, or rotavirus? All right, so a couple of you got it. One got it. Very good. So Synagis, this is for RSV. So this is the vaccine that's only for high-risk infants. So you don't give Synagis to other babies. You know, you don't give it to the random run-of-the-mill baby that comes into the outpatient office. So this is specifically for kids that are high risk, and it prevents RSV. It's a vaccine against the RSV virus. What 2 conditions are considered when a newborn fails to pass meconium in the first 24 hours? Interception and cystic fibrosis, Hirschsprung's and cystic fibrosis, Hirschsprung's and gastroschisis, or cystic fibrosis and pyloric stenosis? All right, so this one was a little bit tricky. The Hirschsprung's is when they don't have that normal innervation, and they if they do pass stool, it's very ribbon-like. You don't necessarily think about cystic fibrosis, but it can. Sometimes they don't pass the first stool. Interception, that's what we talked about. Like I said, telescoping, you usually see that more with preschool age. Gastroschisis, their abdominal intestines are exposed. And then pyloric stenosis, that's that projectile vomiting. So this is the best answer, but I understand we didn't really touch too much on this in class, so I understand why a lot of you didn't know that. So what is the first intervention when a child begins to have a seizure? Raise the head of the bed, turn the patient to their side, insert a tongue blade, or give oxygen below by? Good job. Turn the patient to the side. Nice. So which primitive reflex is the infant in the picture demonstrating? Moro reflex, Landau reflex, rooting reflex, or palmar grasp reflex? Very good. That's the palmar grasp reflex. Nice job, you guys. All right. I know there's a ton of questions. We're a quarter of the way there, though. You guys are doing great. So all of the following are correct regarding the varicella vaccine, except first dose should be given at 12 to 15 months. Child may have redness, soreness at the site. Maternal antibodies disappear after 1 year, or the second dose should be given at 4 to 6 years. All right, good job. So I think there's a couple things like regarding the vaccine. So the vaccine doesn't really have anything to do with the maternal antibodies. And also they probably disappear before a year. So nice job in getting that one right. When teaching parents about child rearing strategies, what must not be included? Limit setting timeouts, physical punishment, ignore negative behaviors, or catch the child doing something good. Yeah, so you don't want to encourage any sort of physical punishment. Nice job. Before administering digoxin, the nurse should perform all of the following except take the apical pulse for 1 full minute, check potassium and calcium, obtain a second witness, or administer even if the child is vomiting. Yeah, good job. You don't want to give an oral medication if they're vomiting. The other things are your safety precautions for digoxin. What are the signs of Cushing's triad? Decreased blood pressure, increased heart rate, irregular respirations. Decreased blood pressure, decreased heart rate, bradypnea. Increased blood pressure, decreased heart rate, irregular respirations. Increased blood pressure, decreased heart rate, bradypnea. Yeah, so increased blood pressure with a low heart rate and the irregular respirations. This is what we talk about when the increased intracranial pressure, this is the name of that triad, Cushing's triad. Very good. Which of the following would be a cause of a sunken fontanelle in an infant? Dehydration, Down syndrome, intracranial bleed, or meningitis? Very nice. Dehydration. What is the most common form of child abuse in children under age 14? Shaken baby syndrome, psychological neglect, or Munchausen syndrome by proxy? Yeah, so very good. So I think shaken baby syndrome, maybe if the cutoff had been a younger age, but you're going to really see shaken baby when they're babies. So neglect is the best answer. The anterior fontanelle typically closes around what age? 2 to 3 months, 18 to 24 months, 12 months, or 2 to 3 years? Very good. 18 to 24 months. Nice job, you guys. Which of the following is not a symptom of increased pulmonary blood flow? Cyanosis, tachycardia, tachypnea, or poor appetite? So yeah, this one is a little bit tricky. So cyanosis, right? So if you get more blood flow to your lungs, you're not going to be hypoxic. You're not going to be cyanotic. You're going to have plenty of oxygenation for your blood. So this is the one that's not a symptom. Which is not an example of a nurse providing anticipatory guidance. Teach a 17-year-old about wearing seatbelts when driving, teach parents to lock up household chemicals, teach parents about water safety, or teach parents of a 2-year-old to wear helmets to ride a tricycle. So I'm going to honestly say, I don't understand this question. So I think they're all examples of anticipatory guidance. So I don't have much to comment about what the logic is for this. So I apologize that I didn't take this one out. So what is the preferred site for injections in infants? The gluteus maximus, the deltoid, the vastus lateralis, or the abdomen? Talking about like injections for immunizations. Very good. The vastus lateralis. Nice job. When is surgery indicated for scoliosis? When it's a greater than 20-degree curve, greater than 40, greater than 30, or greater than 60. All right, so yeah, this one is greater than 40, and the surgery that they do is the posterior spinal fusion. So Hodgkin's lymphoma is associated with which infection? Herpes virus, cytomegalovirus, HIV, or Epstein-Barr? So good job. I don't remember talking about it, so I'm very impressed that some of you guys knew this, Epstein-Barr. So children with nephrotic syndrome are often given what med for fluid overload? Albumin and Lasix, digoxin, spironolactone, or thiazide/diarrhea? Yep, albumin and Lasix. So they spill a lot of protein in their urine. So you'll give them albumin Lasix sandwich to kind of pull some fluid out if they have a lot of edema. So an acute febrile exanthemus illness with generalized vasculitis of unknown origin. What is that? Lymphopathy, rheumatic fever, infective endocarditis, or Kawasaki disease? All right, so Kawasaki disease, good job. This is the one that has like the red cracked lips and tongue. It's the leading cause of acquired heart disease in children. It can cause coronary artery disease. It's the only disease where we recommend that they take aspirin. Good job. What is the most common cause of neonatal mortality? SIDS, accidents, prematurity, or drowning? So prematurity, and I would add into that things like congenital birth defects, etc. So, and a lot of times we don't really know why someone dies of SIDS, but it's going to be more frequent in kids that are premature or have congenital defects. So this one is a little bit tricky. For older age groups, you're always going to be thinking about accidents. Which disease is the leading cause of acquired heart disease in children? Aortic stenosis, patent ductus arteriosus, Kawasaki, or rheumatic fever? Very good. You guys are a little bit torn between Kawasaki and rheumatic fever. Rheumatic fever also does cause acquired heart disease, but Kawasaki is just a little bit more common. What is the most common pediatric cancer? Leukemia, lymphoma, brain tumor, or Hodgkin's? All right, so it is leukemia. Brain tumor is the most common solid tumor, but leukemia is the most common overall. A 5-year-old has unilateral red conjunctiva, purulent discharge, and a swollen eyelid. What do you suspect he has? Viral conjunctivitis, allergic conjunctivitis, bacterial, or chemical? Yeah, so you would lean more towards the bacterial. Good job, you guys. At what age is an infant able to see color and fix and follow an object? 2 months, 6 months, 4 months, or 8 months? Very good. 4 months. Which of the following features does not apply to atopic dermatitis, otherwise known as eczema? Dry, itchy skin, AD may flare up periodically, can be seen with asthma, cure is available, or it causes thickened, cracked, scaly skin. Yeah, so there is no cure available. So that's the one that does not apply. During what age group do you see associative play emerge? Infants, school age, preschoolers, or adolescents? All right, good job. You guys are kind of torn between preschoolers and school age. And I could see why, but really more the school aged. Until what age should a child remain in a crib during hospitalization? 8 months, 18 months, 12 months, or 24 months? All right, so 24 months, 2 years. We talked about in the hospital, you can get what's called a bubble top, which is like a big plastic thing that sits on top of the cribs that helps them not climb out. So generally speaking, they need to be in a crib until they're 2 if they're in the hospital. At what age should a child be able to sit upright on their own? 4 months, 12 months, 8 months, or 18 months? Very good. 8 months. Which immune globulin is elevated in an immediate hypersensitivity reaction? IgM, IgE, IgF, or IgA? Yeah, so I'm impressed several of you knew this. So it is IgE, but I don't think we talked about it in class. So very good. What is most effective in treating oral thrush in infants? IV penicillin, nystatin powder, oral nystatin, or tetracycline? Good job. Oral nystatin. Okay, so we're at the halfway point. I'll give you guys the choice. You want to take a break for like 10 minutes and kind of stretch your legs, or do you just want to power through?
Break.
Break? Okay.
Can we have a
So
quick break?
yeah, I'm totally fine with that. So it's say it's 9:46. Why don't you guys just come back at 10?
Ms. B, did I need to let you know I was here? Like, I'm basically like when you got into question 5.
Okay. No, I'm gonna go ahead and pull the Zoom report, but thank you for letting me know.
Okay. I know. Did you receive my email?
I have not, I haven't checked my email since I started class, so I haven't, but I'll check it.
Okay. All right. That's all.
Okay. Thanks for letting me know.
You're welcome.
Hey everyone, welcome back from your break. I'll just give you a couple minutes to flip your camera on and then we'll get started. Looks like we have some new faces joining us, so welcome to class, everyone. Great, so I'm gonna go ahead and get started here. Let me just do a quick review of cameras. Okay, so unless anyone has any questions, I'll go ahead and start the second half. Does anyone have any questions?
Are you gonna send this to us that we can use for a review?
Yeah, I'll put it in the announcements. And
Okay.
Dr. Bogart did 2 also, so I only have 1 of hers so far, but I'll find Dr. Bogart's also and put them all in the same announcement. But I'll put this one in the announcements today.
Okay, and will we have the pin, will it be the same if we want to go in and play it instead of just?
No, I'll put the pin in there because it's assigned as a homework. So I'll put the pin in the announcement.
Okay, all right, great. Thank you.
You're welcome. So what would be found in cerebral spinal fluid in a child with suspected bacterial meningitis? Decreased protein, increased white blood cells, increased glucose, or negative cultures? So good job. Yeah, the main thing, you have bacterial meningitis that you would really expect to see in that CSF is white blood cells. What is the biggest family stressor when caring for a child with a chronic condition? The child does not meet milestones, embarrassment, not bonding with the child, or finances. So very good, finances, right? You know, that maybe it's hard for both parents to work or there's extra costs associated with care. So when assessing pupils, what are bilateral fixed and dilated pupils indicative of? Impending herniation, a mass, brainstem herniation, or a stroke? So very good. Yeah. So there's so much pressure in there that the optic nerve isn't responding anymore. So you get the fixed dilated pupils. Very nice. All of the following increase intracranial pressure except turning a patient, tachycardia, coughing, or suctioning. Yeah, so this one is a little bit trickier. So if you have, this is kind of more like if you're working in an intensive care unit and you know that your patient is at risk for increased ICP, turning them, making them cough or suctioning, all of that can cause it, a change and increase their intracranial pressure. But tachycardia doesn't really, unless you're having like tachycardia with a high blood pressure or something like that. But these are all things that if you're caring for a patient that's recently had a head bleed or it is at risk, you need to be very careful that when you're caring for them that you don't, unnecessarily cough or suction or turn them because that can increase their intracranial pressure.
That doesn't make.
So which of the following might indicate a child with a physical developmental delay? A 6-month-old is doubled her birth weight. An 11-month-old can stand alone. A 3-year-old is capable of riding a tricycle, or a 12-month-old is unable to sit upright on his own. So yeah, very good. This is the one that's abnormal, right? So this is where you would be worried about a delay. All of the following are categories of congenital heart defects except increased pulmonary blood flow, increased systemic blood flow, decreased pulmonary blood flow, or decreased systemic blood flow. So this one was a little bit trickier. So it is increased systemic blood flow isn't a category. So you can think about increased pulmonary blood flow. These are going to be like your ones that have a left to right shunt, and then there's more blood to go on the right side that goes to the lungs. Decreased pulmonary blood flow, something on the right side of the heart, like a pulmonary stenosis or a tetralogy of Fallot. And decreased systemic blood flow, something like a coarctation of the aorta or something wrong with the left side of the heart. So there really isn't any defect that's in this category of increased systemic blood flow. At what Glasgow Coma scale would you anticipate intubating a child? At 2, 10, 8, or 14? Very good. So this is getting kind of some more into some critical care ICU stuff that we didn't really touch on that much in this class. So I'm very impressed that most of you, or a good percentage of you, knew that. For defects with increased pulmonary blood flow, prostaglandin inhibitors are given to do what? Close the duct, decrease inflammation of the ventricle, keep the duct open, or decrease pulmonary hypertension. So close the duct. So prostaglandin inhibitor. Does anyone remember the name of a medication that's a prostaglandin inhibitor? So it's
Was it
indomethacin.
endomethacin?
Very good. Yeah, so it's indomethacin. So indomethacin is the opposite of prostaglandin. So a prostaglandin inhibitor will close the duct, whereas prostaglandin itself will keep the duct open. Which procedure may be required if the patient has coarctation of the aorta? A balloon angioplasty, a Norwood, a transplant, or a Glenn? Yeah, very good. So balloon angioplasty, they put that balloon in the narrowed area and then they inflate the balloon. And sometimes that'll stretch out the coarctation and they can avoid a surgery. Myelination is incomplete at birth. How do infants manifest this when they're less than 6 months old? By having changes in their pain receptors, it doesn't have any significance, increases their intracranial pressure or their primitive reflexes. All right, you guys, most of you got this. Very good. So yeah, so it's the primitive reflexes that kind of protect them until their myelination is complete. What maternal factors can contribute to the development of a CNS malformations in the fetus? Persistent fevers, reoccurring headaches, respiratory syncytial virus, or deficient amounts of folic acid? Very good. So this is why it's really, really important for women to take prenatal vitamins because, to make sure they're getting the folic acid they need for their fetus. When is giving aspirin to a child indicated? If they have Reye's syndrome, if they have Kawasaki disease, if they have sickle cell disease, or if they have Hashimoto's disease. All right, very good. So Kawasaki disease, it can cause Bry syndrome, so it's not indicated. Kawasaki disease is that febrile vasculitis. It can cause coronary artery problems, and they give aspirin as an antiplatelet aggregator. So it helps keep the blood thin. But this is really the only time in pediatrics that they recommend giving aspirin. If you have mono, the kissing disease, you're at risk for what type of cancer? Leukemia, lymphoma, myeloma, or cervical? All right, very good. So it's a lymphoma. At what age can children start using a PCA pump? 5, 8, 7, or 9? So one of you got it right. So I personally thought it was going to be around 7 or 8. So I would say 5 is definitely the youngest. And this would probably, they wouldn't have a basal rate and would be something maybe on demand. But just to sort of be thinking about that children can use PCA pumps, you just need to make sure that, you know, the parents and the whole healthcare team is thinking about whether they're developmentally ready. So polythysemia is an indication of what? Increased pulmonary blood flow, sickle cell disease, decreased systemic blood flow, or decreased pulmonary blood flow? All right, a couple of you. So what is polycythemia? What does that mean?
Too many red blood cells.
Too many red blood cells. Very good. So if you don't have enough pulmonary blood flow, you're going to have a low oxygen level, and red blood cells carry oxygen. So it's a sign of decreased pulmonary blood flow, or also a sign of chronic cyanosis, that you don't have enough oxygen carrying capacity. So then you increase your red blood cells automatically to be able to deliver more oxygen to your tissue. So the interval between exposure to an infection and the appearance of the first symptom is incubation, communicability, transmission, or none of the above. Very good. The incubation period. What is an important consideration when caring for a child with herpetic gingival mastitis? Wait to brush teeth until all lesions are sufficiently healed. Drink from a cup, not a straw. Apply topical anesthetic before eating, or explain to parents how this is sexually transmitted. So yeah, this is the one, those cold sores in their mouth. So you do want to, like, it sounds kind of gross, but you want to, before you eat, you want to put something in there because it's going to be most painful when you eat. When caring for a child after a tonsillectomy, the nurse should do which of the following? Encourage gargling to reduce discomfort, to watch for continuous swallowing, position the child on his back to sleep, or apply a warm compress to the throat. Very good. So watch for continuous swelling. That's a sign that there's a bleeding at the surgical site that you need to report to the healthcare provider. So which of the following accurately expresses the genetic implications of cystic fibrosis? If it's present in the child, both parents are carriers. It's a genetic defect primarily in non-white people. It's inherited as an autosomal dominant trait, or there's a 50% chance that the other sibling will be affected. Good. Yeah. So it's autosomal recessive. So the child has to inherit the gene from both parents. So if it's present in the child, both parents are carriers. When hemoglobin falls low enough to produce a clinical effect, what are the signs and symptoms due? Phagocytizing, pulmonary hypertension, tissue hypoxia, or decreased bone marrow. Yeah, good job. So if you don't have enough hemoglobin, you're not able to get oxygen to your cells. So the clinical signs and symptoms are going to be related to tissue hypoxia. In what condition is adult hemoglobin partly or completely replaced by abnormal hemoglobin? Aplastic anemia, sickle cell anemia, thalassemia major, or iron deficiency anemia? So yeah, so good job in terms of the understanding. So the sickle cell, that's the one where they're the abnormally shaped hemoglobin. So nice. I know that this is probably a harder question, but in terms of the adult hemoglobin specifically, that's going to be your sickle cell anemia. Which is the most descriptive of the pathophysiology of leukemia? Increased blood viscosity, unrestricted proliferation of immature white blood cells, thrombocytopenia occurs, or first stage of coagulation process is abnormally stimulated. Very good. Yeah, this is where you have the massive number of immature white blood cells that are called blasts. Which of the following is a common clinical manifestation of Hodgkin's disease? Petechiae, painful enlarged lymph nodes, bone and joint pain in large, firm, non-tender lymph nodes. Very good. Just kind of split. You guys all knew the lymph nodes, but just to remember the non-tender. Catabolism and development of ketosis in the absence of insulin replacement is characteristic of gestational diabetes, type 2 diabetes, type 1 diabetes, or impaired glucose tolerance. Ah, very good. So this is a description of diabetic ketoacidosis, which you see in type 1 diabetes. Nice job. In which disorder of malabsorption is it most likely that TPN and enteral feeds will be needed? Meckel diverticulum, short bowel syndrome, anal rectal malformation, or Vactal syndrome? So good job. Yeah, if they're just like missing a piece of their bowel, they're more likely to need support with TPN and enteral feeds. A 2-month-old with jaundice, bruising, clay-colored stools, and tea-colored urine. What is this diagnosis? What is it associated with? Renal failure, biliary atresia, thalassemia major, or tapeworms? All right, good job. So this is your biliary atresia. Fatty floating stools are characteristic of which of the following disorders? Encoparesis, cystic fibrosis, interception, or Hirschsprung's disease? Yeah, so cystic fibrosis, remember that it's both lung and GI, so they're not producing all of their pancreatic digestive enzymes, and as a result, they have those really fatty stools that are kind of frothy. Which of the following tools is frequently used to assess the developmental level of a child? The Glasgow scale, the Braden scale, the Tanner stages, or the ages and stages questionnaire? Yeah, it's the ages and stages, and we also talked about in class the Denver 2. So this Glasgow specifically is for coma scale, and the Tanner stages is for sexual maturation. Which of the following is true concerning susceptibility of pertussis? Neonates will be immune for the first few months. If mom had the disease, the infant will have passive immunity. Children under 1 year seldom contract the disease, or most children are highly susceptible from birth. Very good. Yeah, you worry about pertussis a lot in the young kids and infants, and they are pretty susceptible, especially when they're young. When is chickenpox most contagious? During the rash until all lesions crust over, once the vesicle appears until all lesions crust over, 1 to 2 weeks before the rash until all lesions crust over, or 1 to 2 days before the rash until all lesions crust over. So this is one that's kind of weird that they can actually spread it, when they've been exposed, but they haven't really developed the rash yet. So this is just kind of one of those things to remember, that they're contagious even before their rash starts to break out. Which of the following is true of atopic dermatitis? Children need to be isolated during flare-ups. Good skin care and less relapse is the goal of the chronic disorder. Symptoms usually resolve as children reach adulthood, or bathing less will reduce the irritation to open lesions. Yeah, so it's a chronic disorder, and good skin care and minimizing relapse is your overall goal. What is the best treatment to prevent dehydration in infants with acute gastritis and diarrhea? IV fluids with hypertonic fluids, frequent PO replacement with an electrolyte solution, continuous enteral feeds, or half-strength formula mixed with sterile water. All right, good. So you guys kind of got this. So since it's diarrhea, you can really do the frequent PO fluid replacement. If they're vomiting everything up, that's not a good option. And also, you're not going to give a dehydrated patient hypertonic fluids. So this is really your best option, the fluid intake. What is the purpose of giving indomethacin to a neonate with patent ductus arteriosus? To stimulate prostaglandin and increase pulmonary blood flow, to inhibit prostaglandin and close the duct, to promote the patency of the duct, or indomethacin is not indicated for this neonate. Very good. We saw this one, or a similar version of this. So this is the medication that you use. It inhibits prostaglandin. It's a prostaglandin inhibitor, and it closes the duct. How is the disorder Duchenne muscular dystrophy transmitted? Is X-linked recessive, autosomal recessive, autosomal dominant, or it's a genetic mutation? So it is, we didn't get into this too much. So it's X-linked recessives, which means it passes from mothers to sons. So this is why you're going to see Duchenne's in boys. So women, their chromosome makeup, they're XX and boys are XY. So if you have something that's X-linked recessive, they only have to receive that X chromosome from their mom to have the disorder. Transposition of the great arteries. What is ordered to keep the PDA open? Aspirin, prostaglandin E, digoxin, or indomethacin? All right, good job. So this is the opposite. So indomethacin would close it, but prostaglandin E would keep it open. Chelation therapy in a child with B thalassemia major is done for what purpose? To treat the disease, to eliminate excess iron, to decrease the risk of hypoxia, or to manage the nausea and vomiting? Right, so this is to eliminate excess iron. They break down their red blood cells and they leaves iron throughout their body and their tissues. So the chelation therapy removes the excess iron. Which inherited immunodeficiency disorder has lack of both humoral and cell-mediated immunity? AIDS, Fanconi syndrome, severe combined immunodeficiency disease, or hemophilia? Yeah, this one we didn't talk about, so I'm impressed that 5 of you. This is one where you might, if you had to guess, like AIDS is not inherited. Fanconi syndrome, usually syndromes are, so that would maybe be one. Hemophilia is not having the ability to clot, but this says both humoral and cell mediated, and it says severe combined. So I think if you were just going to guess, you could sort of lock yourself to this conclusion, but we didn't talk about this in class, so I'm very impressed that 5 of you got that right. Symptoms are insomnia, hyperactivity, warm flushed, moist skin, and unusually fine hair. What might this indicate? Hyperparathyroidism, hyperthyroidism, hypoparathyroidism, or hypothyroidism? Good job. We didn't talk about, we talked more about hypothyroidism. So just think of kind of like if your metabolism is too revved up, you're going to be hyperactive, flushed, etc. So this is your hyperthyroidism. A mom says her infant sometimes has a whitish glow in his pupils. You should suspect congenital cataracts, blindness, retinoblastoma, or the rhabdomyosarcoma. All right, so this one is the retinoblastoma. We kind of talked about it really early in the class. It's kind of like that weird cat eye. You can see like this whitish yellow glow right around their pupil, and it is a type of cancer. So you would be concerned about retinoblastoma. A teenage female complains of abdominal pain, nausea, vomiting, fever, and changes in her vaginal discharge. This may indicate a urinary tract infection, pelvic inflammatory disease, appendicitis, or gonorrhea. So this is kind of a tricky one. Obviously, gonorrhea can cause pelvic inflammatory disease, but once you're getting the abdominal pain, then you're worried that it's ascended up and caused more problems in the abdominal cavity. So that the best answer is your pelvic inflammatory disease. You wouldn't necessarily see like a change in your vaginal discharge if it was just a urinary tract infection. So a parent finds a tick on her child. How should you instruct her to remove it? Paint the tick with nail polish to kill it, and then remove it with tweezers. Brush the tick with a rag. Use fine tip tweezers to grip close to the skin and pull up, or use fine tip tweezers to twist side to side until loose. So good. Use the tweezers to grip close to the skin and then pull up. And then who can tell me the name of the disease that's transmitted by ticks?
Lyme disease.
Lyme disease. So why, you don't want to twist it side to side, because then you can actually leave the head in the under the skin. So you want to just grab it and then pull it up. A strep infection which develops into an autoimmune disorder affecting the heart. What is that? Congestive heart failure, your rheumatic fever, Kawasaki's disease, or truncus arteriosus. Good job. So that's your rheumatic fever. So an 8-month-old is assessed and only one testes is palpated in the scrotal sac. He is diagnosed with cryptorchidism, testicular torsion, hypospadias, or torch syndrome. So it's the cryptorchidism, and I'm going to be right back. Someone ring my doorbell. Thank you guys for your patience. So which of the following is not generally associated with the diagnosis of autism in children? Lack of eye contact, seizure activity, repetitive behavior, or oversensitivity to stimulation? Yeah, so seizure activity is not. Good job. A 6-year-old falls and has visible deformity to his right arm. What is your nursing priority? To immobilize the injured area, assess pain with manipulation, realign the deformity, or apply ice directly over the site? All right, good job. Yeah, this one I think is a little bit tricky. You're not going to manipulate, etc. So certainly immobilizing the injured area is your best answer. So Duchenne muscular dystrophy is transmitted by which pattern of inheritance? Autosomal dominant, autosomal recessive, X-linked recessive, or mitochondrial? All right, yeah, X-linked recessive, very nice. So an infant with cleft lip and palate is likely to have problems in which of the following areas? Feeding and language, intelligence and social skills, mobility and language, or fine and gross motor skills? Very nice. Feeding and language. In children with fractures or intraction, what is the priority assessment? Respiratory, Glasgow, GI, or CMS? Very good. So you want to make sure you're checking their pulses and perfusion, the whatever the extremity is that's in traction. Very nice. Teaching parents about cradle clap includes everything except washing hair daily with baby shampoo, applying mineral oil or olive oil to the scalp for 20 minutes, removing scales with a soft brush, or that the condition is contagious. Yeah, so it is not contagious. Good job. What is the appropriate dosage of Tylenol in children? 5 milligrams per kilo, 10 to 15 milligrams per kilo, 10 milligrams per kilo, or 15 to 20 milligrams per kilo? All right, so we didn't get into this, so I'm impressed. It is 10 to 15 milligrams per kilo. Nice job. All right, podium. Faye. Leah. All right, good job, you guys. Very, very nice. So I'm going to be completely honest with you. I am having a hard time thinking because that was so much information in such a short period of time. So I'm going to go ahead and let you go early because I think that we're all just a little bit fried. But before you go, if anyone has any questions or they want to bring up any points, please let me know now. Does anyone have anything, any questions, any concerns that you want to bring up with the class?
Is it possible that I can get like a one-on-one review?
Absolutely. Yeah.
Okay.
So Makeda, do you want to go over your exam 3, or what are you hoping to, what do you want? Just like a HESI review, or what are you looking for?
I would like to go over the first and third exam.
Okay, absolutely. Just I'm usually free more in the afternoons, so like just send me your schedule and I'll email you back with the time that works. But usually after 1 p.m. Eastern, I'm free.
Okay, thank you.
Okay. Anyone else have any questions?
I have a question after class, Professor, if that's okay.
Yeah, that's totally fine.
Okay.
Thanks for a great semester.
Yeah, thanks for having you guys. And I know that, like, you know, they should be sending out survey requests. So I would appreciate it. Anyone that has time to fill out the survey. It only helps me understand your perspective. So I really appreciate anyone that takes the time to fill that out. I really appreciate that. Okay, so if someone wants to stay on and ask me a question, that's great. If no one else had any questions, you guys are free to go. And then please send me a message when you're studying for the HESI, if anything, if you have any questions, okay?
Thank you. Have a good day.
You're welcome. Have a good day, everyone.
Thank you.
Thank you.
I just want to ask, did I miss anything like when class first started, or do we just needed to make sure that we were registered for the HESI?
Yeah, just making sure that I'm gonna, just so you know here, let me stop recording here really quick.